What is the future of healthcare? What's the big thing coming next in healthcare for you?
Look, I mean, I think I would mix public policy and technology in healthcare. And I would say, I know we're debating it right now. I ran our healthcare business. We're a big payer in healthcare. You know, we've been doing employee healthcare since 1947. If anybody thinks anybody's going to solve healthcare this year, you're crazy. We're going to be working on healthcare for the rest of our lives, and everybody's going to pay more. People are going to pay more, the government's going to pay more, companies are going to pay more. So let's get those two things out of the way in the beginning. And then I'd give everybody 4 things to think about as it pertains to healthcare. One is consumerism. You're never going to fix healthcare unless you link the consumer with the provider. And the sooner that happens and people think about their own wellness in a constructive way, that's got to happen.
Wait, explain what you mean by consumer to the provider.
Look,
you pay for some of your health care?
We went in 2010, 2011, GE went to kind of HSAs, a high deductible plan with our workforce. My wife and I had never read the GE benefits plan, and I ran the place, right? So that was the first time we sat down and said, okay, how much do we want to pay? What's the cost? And that's, you know, pretty sophisticated buyer in a big company. So we're completely divorced between the people, how healthy they want to be. When they sprain their ankle on a Sunday, do they want to go to the emergency room or grab a bag of ice? And then if you're sick, if you have pancreatic cancer or something like that, we need to take care of you. We need to make sure people, so that's consumerism. Chronic disease, 70% of all healthcare dollars are spent on chronic disease. That's only going to get worse because people are going to live longer. And if people start dying of aging diseases, there's no way to estimate what the cost is going to be. So chronic disease matters. Low-cost systems, GE's big in 15 cities in the US. The difference in cost per patient, the low city to high city, is 50%. So just by the function of where you live. So getting variance reduction into the system, that's important. And then payment reform. We just have horrible incentives on payment reform. So let's fix 1 or 2 of those things. Let's work on them sequentially. But the notion, Walter, that like every time, so we basically, from the 1970s or 60s until 2010, we worked in contextually the same healthcare system in the United States. So now, if we have to change healthcare plans every time there's an election, so if we're now on 4-year cycles with 20% of the country's economy, we're in a bad place.